With my insurance, I can actually go anywhere, but I chose the Chattanooga Heart Institute. I talked with my doctor, and we both agreed that was a place for me to go.
Mr. Lewis was referred by his primary care physician after he had had an abnormal EKG in preparation for a surgery.
The doctor I saw first was Dr. Ulrich. I liked his style. We got together, we talked about tests. We went through the testing process, and everything proceeded pretty smoothly, actually. The type of tests that were run started with just an evaluation, a conversation. What do you feel? What's happening? Then he explained, here's what we should do, step by step. I really felt like I was involved in the process.
The CT scan was performed, and I had Mr. Lewis return with his wife to the office. We found that Mr. Lewis had significant plaque in his heart arteries, but no sign of any significant blockage yet, and no sign of any permanent heart damage. Treatment of a narrowing with a stent only treats one area. Going back and treating the process which allows plaque to form is the most important thing to prevent heart attacks down the road.
The lifestyle changes that Dr. Ulrich recommended are really working. It's a change of diet, exercise, things you should be doing anyway. Overall, how I feel about the Chattanooga Heart Institute, excellent marks, very high marks. I'm glad I went. I have all the answers that I need. My lifestyle is more complete because now I know what I'm supposed to do.
With aggressive risk factor modification, controlling his blood pressure and his cholesterol, Mr. Lewis has an excellent chance of not having further heart problems down the road.
Your heart is very important. I mean, this is everything. And when you don't pay attention to what you should be doing with your heart, you're not that happy and you're not going to be doing many things. The biggest change in my lifestyle, well, I can have more of it. That's the main thing.